Good afternoon. Welcome to today's webinar on housing and patient health. I'm Paul Cartwright. I represent Aico as National Account Manager, and I'm basically going to introduce our speakers today. We have Professor Tim Sharp from the University of Strathclyde and Dr. Gareth Morgan from representing the NHS in Wales. And we do have Adam Taylor-Drake in the studio with me today, speaking from HomeLink basically. So I'll immediately introduce Professor Tim Sharp to speak and ask him to run through his presentation on ventilation. Thank you, Tim.
Good afternoon. Can I just check that you're okay? You can see and hear me okay, yeah? You can see the slides.
Yes.
Fine. In that case, I shall crack on. Good afternoon, everybody. So I'm just going to give a very brief overview of issues of ventilation and health in housing. So I'm Tim Sharp. I'm head of the Department of Architecture at Strathclyde University, and we've been involved in this area for some time. Some brief stats about housing: about 26 million homes in England and Wales. Only about 70% of them are sort of modern standards. So the overall stock is pretty poor thermal performance. We know that there are clear associations between health and decent homes, and the issues I think are probably well known: damp, mould, overcrowding, density, and things like that. There is plenty of policy and advice around health and housing. We know that there are very strong links between ventilation and health, and there are several relatively recent publications which have pointed this out and have referred to it. So the RCPCH work on the inside story, the NICE work on indoor air quality at home as part of both, well, in fact, all of these groups. Chief Medical Officer for England last year. The report was on air pollution, but a chapter on indoor pollution as well. And something very recently published end of last week, Understanding and Addressing Health Risks of Damp and Mould in Home from DLUHC, again, talking about kind of ventilation. So we know that these problems exist. We know that they're important. And we have an insight as to why they happen. Ventilation and indoor air quality is a fairly kind of broad term. Includes lots of things. It's moisture, it's temperature, and we know about moisture and temperature in terms of things like damp and mold and heat stress and exposure to kind of cold and so on. I suppose the one thing which is starting to be sort of more significant interest is the issue of pollutants. Some of these are organic things and things such as microbes and bacteria and so on. But also things like particulates, very small particles coming from a variety of sources. But also, we are now seeing a lot more chemicals inside buildings. End of 1900s, maybe 50 materials. In 21st century, 55,000, and a lot of those are synthetic. So things like volatile organic compounds. A lot of these contain some quite nasty stuff: carcinogens, endocrine disruptors, toxins, mutagens, and so on. So there's quite a lot of stuff appearing in homes that we have to kind of think about. In terms of thinking about health, there are two kind of main things that we really need to do. One of which is source control. So that's stopping things being inside in the first place. So that may be to do with the choice of materials or furnishings or cleaning materials and things like that. But the reality is that we're always going to have some forms of mitigation, some means of removing pollutants from inside the home. And the principal means of doing that is through ventilation. There are four main strategies for ventilation in UK homes. They're fairly simple. They are intermittent extract with trickle vents. So that's your extract fan in your kitchen and bathroom and your trickle vent in the window. There's one called passive stack. This is actually quite rarely used, and that just relies on natural thermal buoyancy to remove air. Not very widely used. The next one is continuous mechanical extract. So that's where you have a fan which is running at low speed, relatively low level somewhere in the house, and that is drawing air out through the rooms. That may be centralized or decentralized. So centralized is in the diagram. There is one kind of fan which is doing that. Decentralized actually looks very similar to the first one. It's those extract fans in the kitchen and bathroom. It's just that they run continuously. And then the last one is continuous mechanical ventilation with heat recovery, which extracts air from spaces, wet spaces, but also recovers that heat and puts it back into the home. So that's becoming of interest for a number of reasons. Um, one of those is a lot of what we're doing is being driven by the zero carbon agenda. We are obviously focusing on heat loss, but as we improve fabric, then issues of ventilation become more important as we make buildings very airtight, and we are making buildings more airtight. That's been a relative success. It means that the emphasis on ventilation becomes more important. These changes also have other impacts. It changes how we use construction, the types of materials we use. There are changes in people's lifestyle and expectation, how people sort of use the home, and how people interact with things like clothes drying and so on. I don't know if you can read that sign, but it's saying take any personal items out of these drying areas. It's a fire hazard, so people dry clothes indoors. So ventilation is at this kind of tricky place. We on the one hand, if we reduce ventilation, that reduces energy loss, but it's poor indoor quality. On the other hand, if we liberally ventilate, then we lose a lot of energy through that. So there's an impact there. The key bit of this is that we are doing things differently. We are using new materials, new building forms, new technologies, and so on. It's really important that we learn from those. In effect, they are a series of experiments. So it's really important that we go back and look at how we do that. And that's something that the construction industry is very bad at doing. If the construction industry, if the airline industry worked the same way as the construction industry, that's what your EasyJet flight would look like. We don't really sort of advance terribly quickly in this regard. We've been involved in a whole range of projects which have examined this. I'm not going to talk about these in detail, but we've looked at how buildings are ventilated. When we do this, we use carbon dioxide. It's a really good proxy for ventilation for occupied buildings. So we all breathe out CO2 at reasonably known rates. So when we are monitoring buildings, we monitor CO2. And that gives us a good indication of how well or not the buildings are ventilated. The kind of targets that we're looking for is around keeping things around about or below 1,000 ppm, 1,000 parts per million, and that's about equivalent to 8 liters per second per person. That's widely regarded as being good ventilation. You can see the quote from them, from Wachowski, and that exists in some standards, it exists in guidance and so on. The problem is we are not seeing that. When we looked at those dwellings, when we measured CO2, what we saw was very high CO2s consistently. I mean, across the year, it wasn't just a winter problem. Looking at bedrooms in particular, it's the green line there. So every night in every bedroom, they were very badly ventilated. There are all sorts of reasons for that. One of the things is that when we went and actually then tested those ventilation systems, we found that quite a lot of them really weren't doing very well indeed. We've done various projects which have investigated this in more detail. I'm not going to talk about these in any degree of detail. The first one was looking at just simple extract ventilation. Again, we went and measured, we did a survey and we went and measured some buildings. We found some interesting things. One of which is that people really didn't interact with that ventilation system. So things like trickle vents were kind of closed most of the time. There are things like the main reasons that people had for using ventilation was it was too hot, so they're using it for thermal control. But the reason for not opening ventilation or windows was because they're worried about heat loss. Key thing in this study is when we asked people what they thought about their air quality, indoor air quality, they said it's fine, it's good. When we went and measured it, we found something else entirely. So difficult graph to explain, but the bottom line is, in a perfect world, there wouldn't be anything on this graph. This is the percentage of time that those buildings are above 1,000 ppm. Having the vents open, having the windows open helps, but it really doesn't do the business. And plotting that, nothing like nothing like 8 liters per second per person. Did a similar project looking at decentralized mechanical ventilation. Again, that's that system where you have a constantly running fan. The problem here is that there are lots of ways that can go wrong. Although you've got that constantly running fan, whether that's drawing air through the whole house is a slightly different question. Again, in this graph, again, this is the percentage of time that levels are high or above, 1,000 ppm, and you can see, fairly consistently poor ventilation in most of these things. Again, nothing like 8 liters per second. Last one is just looking at MVHR. So mechanical ventilation and heat recovery. The idea is actually very attractive, that you have a fan, it draws wet, moist, waste air from kitchens and bathrooms, recovers the heat, then uses that heat to heat fresh incoming air and supplies that into other rooms. Just looking at this, again, without going too much into the graph, shorter bars are better and the red bars are MVHR homes. So what we tended to see is that those homes actually perform better than ones with with natural ventilation, with trickle vents and windows and so on. Now, that's not to say they are working perfectly, but they're working better. It's probably important to recognise, in this sample, quite a lot of these were passive houses, so very well designed, very well kind of managed homes that we were looking at. So it's tempting to conclude that MVHR is an attractive proposition. There are some buts. One of those buts is that they weren't necessarily doing what they needed to do in terms of extract rates in quite a lot of those homes, particularly the ones which weren't passive house, which were more mainstream homes. They tended to struggle. There's quite a lot of things which can go wrong with that system. So, poorly designed, poorly installed, the wrong type of ducts. Lack of maintenance is really important. These things require filters, and you can see the image there. If you don't clean those filters, they get pretty clogged pretty quickly. Issues of noise was a big issue, and that impacts on people's perception of these things. A lot of people, this is quite a sophisticated system, and a lot of people didn't really understand it. They didn't know whether they were supposed to maintain it. Issues of noise were quite kind of common. So although it's an attractive system, it's a continually running mechanical system. So if that starts to go wrong, then you might start to worry about its overall kind of performance. For this reason, it's important that we do these post-occupancy evaluations, that we start to monitor buildings in use, that we try and understand whether things are working or not, and where the attention needs to be focused. So a lot of these projects are starting, we have gathered data in these kind of projects, and that's really important, because that helps you to understand exactly what's going on in these homes and what you might need to do to address it. And that's really important in terms of giving that feedback. That might be to the occupants in terms of things they're doing, might be to the landlord in terms of things they need to fix. It might be to designers, which is, you probably need to do it differently next time, or at least going to change it. It's important to recognise that that this impacts on existing homes just as much as new ones, perhaps a lot more so in new homes, on existing homes, because they start off being in a pretty poor place to begin with. One last thing, I'm just conscious of time. One last thing I'll just talk about quickly. We've just completed a national survey of ventilation and provision homes. This is slightly hot off the press, and we haven't published this yet, so slight kind of caveats there. Basically, we were asking how many homes in the UK have got adequate ventilation provision. And by that, we mean they've got an extract fan in the kitchen and bathroom, and they've got trickle vents. And that's based on what is widely accepted to be good practice, and to ensure that that houses have got that ventilation. It's been in standards for nearly 40 years now, so not anything kind of new. Headlines really, that if you take that provision, do you have an extract fan and a trickle vent? 66% of homes don't have that. It changes for older homes, obviously, but even in new homes, ones which should have had this, a lot of them don't, perhaps a third. We also asked whether people have had any advice on how they're supposed to ventilate their homes. Only 23% had, and if you add that figure to the 66% who don't have ventilation provision, only 11% of homes in the UK have got proper provision and have been advised how to use it. There are other things within that in terms of associations with damp and mould, and older stock as well. Actual provision may be better. We are relying on occupants' observations of their systems here, but it's likely to be worse. Again, referring to the previous slides about things which weren't working properly, although they're there, they're not working properly. So obviously the work I've mentioned previously, but what we are seeing is quite a lot of new standards are requiring monitoring performance. That's quite important now, and we're seeing some things in regulation as well. So in Scottish building regulations, there is a requirement for CO2 sensors in buildings. There's other buildings as well. That's now included. That's the main kind of things really. I mean, one of the challenges we've got here is that it's been very difficult to demonstrate causality of ventilation health because we don't have large scale data. We know that things are changing. Zero carbon and health are major agendas. But if we're going to meet those things, then we are going to have to collect actual performance on data. We need that data to understand what's going on, but also to build better tools. If we want to design better, we need to have better tools to help that. Retrofit is going to be a big challenge, but all these emerging standards are requiring in-use performance, and that's obviously the direction of travel. So that's why it's important to undertake monitoring, to identify those areas that really need attention, and then to use that to give some kind of feedback as well. And I think that's me. Hopefully I'm reasonably in time. There's links there, and I think the slides were made available. So I will finish there, and I'm going to hand over to Gareth now. Let me just stop my share.
Fantastic. Well, thank you for that handover there, Tim. And Prynawn da pawb. Good afternoon, everyone. I'm speaking to you today from Hywel Dda University Health Board in West Wales. I'm based in a hospital in Llanelli, in Prince Philip Hospital in Llanelli. Just something that may be helpful during my talk is to say that I'm a public health practitioner, Dr. Gareth Morgan, but I'm a non-medical practitioner, so I often think about the upstream elements of housing and health. And just for the duration of my talk, I'm going to put myself off camera just so that I can focus on the slides, but I'll be back for questions later on. And firstly, really, thank you for the invitation to come and speak today. It's a great opportunity to address everybody. And I'm going to give a two-part talk today. Part one is very much about the broader context of my work on housing and health. And then I'll come on to part two, which is specifically about the air quality and the impacts on health. And it's important to do it in that order because air quality is part of a bigger picture in terms of the housing agenda. If I could have the next slide, please. So part one of the talk really is just to introduce, just for a few minutes, about the broader context of my work. I'm actually leading a project in Wales at the moment called Building Bridges Between Housing and Health, because as we heard previously, housing is a major factor in health and well-being. And we also know it's a major factor in both hospital admissions and hospital discharges, so both at the front door of the NHS and also at the back door of the NHS as well. And we all know that cold homes, for example, especially in winter, may increase the risk of being admitted to hospital, especially if you've got underlying heart or lung disease as well. And of course, many patients also in hospital need housing adaptations to facilitate their discharge. For example, if they've had a stroke where mobility might have changed. So just a bit of a rhetorical question, really. We know this is a really important connection, and it raises the question as to why housing and health is not being taken forward in a more systematic way. And just hold that thought for now. Can I have the next slide, please? So just part one of my talk, an introduction, really, partly about myself, but also about the subject. So I'm not new to this. My interest in housing and health goes back at least a decade. I've been in the NHS for nearly 30 years in the field of public health, and have worked with many groups over that time who've experienced health inequalities. And housing is one of those key elements because We know there's a very strong correlation. We talk in public health about the correlation between health and wealth, which obviously predicts housing status as well. And obviously, this has got a very long relationship. We've heard previously about crowding, poor sanitation. We've known this since Victorian times, probably even the Romans themselves were very much aware of that. So this is not new. The evidence base is quite extensive and quite historic as well. Having said all of that, in current times, housing is still as relevant for health and well-being as ever. And I'm very fortunate to be holding a Bevan Exemplar Award for building bridges between housing and health. For those of you that know your history, Aneurin Bevan, a Welshman, was the founder of the NHS. And so we've got a sort of award, a very prestigious award here in Wales for Bevan Exemplars, which gives a very strong quality assurance, very hard to get. So we've got this for housing and health, which gives us a really great opportunity to do something nationally, not just for Wales, but of course sharing that experience with other partners, both in the UK and broadly beyond that as well. Next slide, please. So what is the challenge really? And just really to remind us all that there's currently a cost of living crisis that has of itself potential to have a massive negative impact, especially as we move into the colder weather. In fact, in Wales today, it's cold and wet, but certainly over the next few weeks, that will certainly start to happen. And for some families, we know this may be a tipping point, especially in poorer communities, not just in Wales, but in other parts of the UK as well, often leading to very difficult choices about how the household budget is spent. And from an NHS perspective, which of course is my entry point into this, we know that this could have a massive negative impact as well. Obviously, the physical health effects of making chronic underlying disease worse, if you live in a cold home, for example, but also not to be underestimated as well, the psychological impacts of that on mental health and stress, etc., which is another concern as well. And just to give some metrics around this, Public Health Wales have estimated that the cost of poor housing to health is about £100 million per year, with the wider societal cost being about tenfold that in terms of loss of productivity, impacts on the economy and so on. So these are really big numbers that we're talking about in terms of some of the economic impacts. Next slide, please. And having said all of that, and I could give you an hour's long talk about the evidence base here, I'm actually more interested in the so what can we do? And partnership working's got to be the way forward in terms of NHS, housing sector, local authority, and indeed all our partners. There's room for all partners with this. So what we've done here in Wales with the Bevan Exemplar is we've developed a good practice guide. As I say, the evidence base is so strong that what we need is actually a framework on what to do and how to do it with respect to housing. Now, there's a lot of good practice out there, not just in Wales, but in other countries as well. And back on that question about why this hasn't been organised into a systematic programme, often the NHS, and understandably, thinks about acute pressures. What's the pressure at the front door? And sometimes we forget to address the upstream determinants with housing. So for me, it's about changing that narrative, trying to fill that gap between housing and health, which is why exactly I went for the Bevan Exemplar Award. What we did was we convened a community of practice of many partners from across Wales, and we developed this good practice guide, which is really about promoting reflective practice. It's trying to get health services to think about the housing agenda across Wales, and also to learn from other parts of that so that we can have this hugely beneficial impact if we address this. Could I have the next slide, please? For anyone that's interested, I can send you the full good practice guide that we've developed. Just in summary terms, it's a 10-domain good practice guide. I like simple numbers, so each one is scored 1 to 10, with 10 being fully implemented. Just to pick out a few, we can't do this as an NHS without our partners, and I would argue that partners can't do this without the NHS. We need to develop our referral pathways, which is really key. Not just about air quality, but also in terms of other aspects of the house, falls and fractures, accidents, but also housing adaptations to facilitate discharge from hospital. It gives a nice percentage It's been tested within my health board here in Hywel Dda, and we're looking now to do further testing in other health boards with a view to this becoming an all Wales good practice guide in the next year or two. So very ambitious with this. Next slide, please. Just really my final slide before coming on to the topic for today, but really important to set this broader context, just in terms of some of the key timescales. And this has been a really fast moving project. So 2 years ago, I applied to the Bevan Exemplar. 18 months ago, we convened the community of practice to produce the Good Practice Guide. It was an all Wales group, but it was a very critical group. So we went through several iterations to get the Good Practice Guide. And then we've developed this over the last 12 months and tested it, with my focus very much at the moment to speak to as many interested parties as possible so that we can spread this and learn from each other as well. Last September, I attended the Spread and Scale Academy in Cardiff, and we've got some fairly ambitious plans, including the rollout of the Good Practice Guide, plus also discussions about a centre of excellence with an academic partner in Wales as well, so that we can bring together research, practice and policy into one place. Next slide, please. So I'm going to come to part two now. I really think that was quite important to set that broader context as to where air quality fits within this broader agenda. And the previous speaker mentioned about the NICE guidance, NG 149, which focuses on the air quality agenda. Just for the avoidance of doubt, the National Institute for Health and Social Care Excellence, this is a really important source of guidance for healthcare providers, because what it gives is credible and evidence-based guidance. And of course, we also know that this needs to make some kind of economic case as well. So really important that we've got this guidance. So the one I'm just going to pick up today is NG 149, which was published in January 2020, just as we were going into the pandemic. And there's two comments that flow from that, really. The first was, obviously, we were going into a lockdown scenario. The focus, especially from the healthcare side, was on the pandemic. So possibly this is one of those areas of guidance that might need a fresh profile, given the timing of it and given what happened in the first few years of that. But also with 4 years on, or nearly 4 years on, so possibly we might need to see whether we can update the guidance as well. Now, for anybody that's read the guidance, it's quite a long document, but there are some excellent summary sheets available. And what I'm going to do today, just with my focus in terms of NHS priorities, is I'm going to focus on the 3 patient groups specifically mentioned, as of course my focus is the NHS side of things. Next slide, please. So the first group that I mentioned is patients with breathing and heart problems. Obviously, really logical in indoor air quality. First point of contact is the respiratory system. In fact, that's a really large cohort of people when we talk about that, because clearly heart and lung disease covers a wide range of different conditions across all ages. So things like childhood asthma, but also later in life as well. So we're talking about a large cohort in the community where this guideline is very relevant. And more importantly, or perhaps as importantly, we know that these conditions can coexist as well, not least because they have some shared risk factors, and the most obvious one being smoking. So with this particular group of patients, we're talking about several recommended actions for healthcare staff. This is about discussions with patients about indoor pollutants, and also asking about the house if lung disease is getting worse. For example, the triggers that might be involved in forms of sprays and aerosols. Just a few comments from me from a healthcare perspective is that the NICE guidance is credible, yet first question, to what extent are healthcare professionals aware of the guidance? And also, what are the education implications for healthcare professionals? We know that lifestyle is an important part of disease. We talk about diet, alcohol, exercise, and smoking. But what about the domestic environment within a house as well? So perhaps we need to have some education for healthcare staff to support the implementation of this particular guidance for this particular cohort and the importance of air quality. Next slide, please. And then the next slide relates to people of all ages who are vulnerable to an allergy, and in particular because of dust mites. And one of the key elements to this is maintaining clean bedding, because as an allergic reaction, this can affect the upper airways of the nose and the throat, as well as the lower airways of lung disease, as well as the skin through a condition called eczema as well. And again, this has got a real potential to have a widespread impact on a range of illnesses, of which could result in demands on NHS services, such as GP consultations, and of course, prescriptions for patients as well. And again, I'd like to make some points about this. The first is the impact that this could have could be considerable given the broad range of conditions involved. And secondly, healthcare staff could help to reduce this by offering advice to patients and their carers about potential remedies to improve air quality. So this is quite an important group of people as well. And then next slide, please. And then the third and final group that's specifically mentioned in this relates to pregnant women and young babies under the age of 12 months old. Now, of course, there are well-documented risks of smoking in terms of direct smoking and the risks of vascular disease and cancer, but also about the dangers of second-hand smoke, and also some emerging evidence on third-hand smoke where particles can settle into clothes, curtains, carpets, and other fabrics. So, of course, whilst we still need to offer messages around smoking cessation, or at least smoking away from other people to avoid the second-hand smoke exposure, potentially there are other triggers as well, such as open fires, exposure from candles, which could all potentially aggravate lung disease as well. And again, this might need some wider education, because even if the public are aware of the risks of tobacco products, there may be risks from other triggers, and they may be less well known, especially for this group of individuals in the community of pregnant women and young babies. And again, that may be something where we need to improve the education for healthcare staff. Next slide, please. So perhaps unusually as a presenter, I'm just going to put a few questions up there before I come to my final slide. The first of these is, to what extent is NICE guidance being used? And then arising from that question is to ask, what are the barriers and also the enablers for the implementation of this guidance? Perhaps then looking forward, we can ask whether we need to give this fresh guidance, a fresh profile, and also measure the impact to date. And given we're nearly 4 years on since the circumstances of the launch, whether there's other evidence we might need to build into this. So if I come to my final slide, please. And really, in closing, housing and health are closely linked, and they affect a wide range of illnesses, and it's also a key determinant in the pressure of NHS services. Potentially, we could do more as an NHS to do more about this, and in particular to engage with patients about the importance of housing, and more widely to work with our partners to drive forward further projects. Specifically on air quality, we've got NICE guidance, which is a real strength, yet there are still unanswered questions about the impact of this. And I'm going to stop at that point. I'd like to thank you all for your attention. And I think I now need to cue in Adam for the final presentation today. Thank you very much.
Thanks very much, Gareth. It's always really interesting to hear about the Bevan Exemplar Award and all the work you're doing. So, good afternoon, everyone. I'm Adam Taylor-Drake from Aico HomeLink. So I'm going to talk to you a bit about the system that we've built over the last 3 years that's helping landlords actually identify these issues in properties and hopefully take corrective steps. So the HomeLink system can be described as a Fitbit for the home. This effectively allows landlords to identify property issues early on, highlight worrying trends, and prevent serious health issues. And we do this by monitoring the indoor environment using a sensor that we design in-house. Our sensors are completely designed and manufactured by Aico HomeLink, giving us complete control over the quality control and the supply chain. Readings are taken every 15 minutes, which allows us to build a very detailed picture of the conditions within each property. The sensors have a 10-year battery life, meaning they can be installed and left with very little maintenance, very little or no maintenance, and they can just operate in the property for extended periods of time. And they're designed to be discreet and unobtrusive, so they can fit into the resident's home. The portal is the property and resident health-centred portal. This is how our landlords access the information and can make decisions about which property they need to target. We show real-time temperature, humidity, and CO2 data. We generate notifications of harmful environmental conditions so that landlords can take proactive action. We continuously monitor across 8 risk areas. This is what we call our insights, which are machine learning-driven analysis of the data we're collecting. And one of the biggest benefits of our system is that we do multi-room sensing, which allows root cause identification of issues at the room level. We collect humidity data. This allows us to identify rooms with high levels of humidity. We can spot trends at certain times of the day. And we can also allow landlords to compare like-for-like properties. We collect temperature data. This allows us to detect over and underheating. So as the previous speakers have said, some of the health conditions that can be exacerbated by these conditions, these extremes of temperature, we can detect those conditions and actually allow the landlord to intervene. We can identify fuel poverty early and help signpost the resident to any support or funding that might be available from their landlord, and hopefully nip that in the bud before it becomes a more serious problem. We can compare with seasonal variations and compare by different property archetypes. And finally, we collect CO2, carbon dioxide data. So this is the gas that's exhaled by people when they're living in their properties. And as Tim's already said, there's a huge number of impacts upon health from high levels of CO2. And it's also a very, very powerful proxy for indoor air quality, as Tim's already said. It effectively lets landlords measure the level of fresh air in a room. So if there's a high level of CO2, it stands to reason that there's a very low level of fresh air coming into the room. It allows landlords to identify potentially harmful ventilation issues. All of our real-time data feeds into a continuous monitoring system across 8 risk areas that we call our insights. These areas include cold home risk, damp and mould risk, excess heat, and indoor air quality. And not to mention, we also have a dust mite allergens risk, which is based on an analysis of the temperature and humidity conditions in the room, and it will actually highlight which rooms are at risk of fostering the development of dust mites. The wider societal benefits of the Aico HomeLink system. So by alerting landlords to potential issues early, we can actually help them become proactive and start to tackle issues that may develop into health complications for the resident. The end results are homes which are better suited to patient recovery, reducing the likelihood of hospital admissions, thereby reducing cost pressures on the NHS. And this is particularly noticeable during the winter months and with the cost of living crisis, driving pressure on residents to struggle to heat their homes. Just want to talk about a case study. So a couple of Welsh landlords that are actually pioneering our technology to help with these issues. Tai Calon, First Choice Housing, Mellon Homes, and Caerphilly Borough Council are all deploying our sensors to help identify issues in properties. In this particular case, a landlord was alerted to a high level of CO2 in a property. The housing officer got in touch with the GP. The GP, along with the housing officer, interrogated the data and did some analysis with the permission of the resident, and this led to a favourable outcome in terms of the health of the resident, with a plan for how to get them to a better ventilated situation in their property. Another case study, so the schools are using our system across the country, identifying classrooms with high risk of cognitive impact and cognitive brain development impacts that are related to high levels of CO2. Our system gives them an analysis of the time of exposure, so how much CO2 is in the properties, how much CO2 is in the classrooms, and for how long, and how much are the children exposed to. And it helps us provide targeted ventilation improvements. So thank you very much, and we now have a short Q&A session that will be open to everyone in the chat. So thank you.
Thank you very much, Adam. Really good. We do have a few questions what have come through. If anyone else has any questions, then feel free to put them in the Q&A. I'll go to the first one for Tim. The new research you mentioned, Tim, when will that be expected to be published?
We have submitted a paper. We're just doing the corrections at the moment. hopefully they'll be accepted. So if that's the case, then it should be out in the next month and a half, I would expect.
Brilliant, thank you very much. And
that's the last one. That's the one on that's the ventilation
yes.
survey. All the previous ones have been published, and in my last slide there was links to where they can be downloaded.
Yeah, I assume it's about the research you were talking about what wasn't published. So yeah, thanks very much for that, Tim. Gareth, an outside housing provider asking how can they be involved with the Bevan Exemplar?
Very happy for colleagues to have my email address. So if you want to get involved in the Bevan Exemplar, we can discuss what your interest might be. We want to learn from everybody. We also want to share good practices as well. So I'm open for all correspondence from anyone that's interested to get in touch with me.
Thank you. We'll do a follow-up email following this session to everyone who's attended. So we'll make something available for them to be able to reach out to you to get in touch. That's fantastic. And Adam, have you any examples of sensors being used in NHS properties?
Yes, so we've done a number of pilot schemes with a couple of NHS trusts. So one large trust up in the north, where we're actually deploying a number of sensors across different property types, and some of those are actually in hospital clinical areas as well to measure the impact of indoor air quality, but also to look at how those spaces are being utilised and whether they were actually fit for purpose, whether the ventilation was sufficient. So there's quite a lot going on in that area.
Fantastic, thank you. Another one for you, Adam. You said about landlords. Is there scope to offer this to homeowners to understand their home environment and the impact on their health?
Yeah, absolutely. So anyone can purchase the gateway and sensors that you need to get this data. It's available. You can get in touch after this, and we can help put you in touch with local distributors that hold the stock, and we can get you set up and using the dashboard, within minutes.
Yeah, we've got someone else asking if possible, can details be shared of those leading Aico pilots in housing associations in South Wales?
Yeah, absolutely. We can put you in touch.